to sort her out. She was not sleeping. She was a 4-year-old who wasn't sleeping, misbehaving, and we could see things, right? She just wouldn't stay focused. The teachers were complaining about her behavior, very hyperactive, and people would say the thing like, oh, she's really energetic, suggestive side eyes, people would say things in their minds. And we insisted that she get assessed at 4, even though that's not the standard. We were repeatedly told the standard age to get assessed for behavior issues was 7. So I was like, no, we need to start working on a solution now. So we ended up going to Delaware. They did an assessment with a psychologist and they did diagnose her with ADHD. They recommended medication. We were not interested in the medication. If anything, I was pushing back and asking for a sleep study because my husband and I were aware that she was grinding. She was bedwetting, and she also had dark circles. She looked like an unrested child. And around the same time, I was finding courses online. This was during COVID for like MyoBrace, Healthy Start, and Vivos. And the more I was studying, the more it became obvious to me that my child wasn't sleeping. Then we did assess her sleep, and sure enough, wasn't sleeping at all. She was RDI out the roof, just she was not sleeping. She probably would get out of like a 10-hour night, maybe 1 hour where she wouldn't, could actually be restoring herself. But after about 2 weeks of her and an appliance, her teachers thought we were medicating her. Even my husband and I noticed a difference. She looked better. Her grandparents were like, oh, she's actually fun to be around. But her teachers were the biggest feedback, thinking we had medicated her and we hadn't. She was just sleeping. And even now, when you look at pictures of her at the time to where she is now, her face, she looks healthier. She doesn't have, and we're brown, we're like dark brown people. No more dark circles under her eyes. She actually just looks like a regular 6-year-old child. No medication, and super alert and loves school. And we've noticed at home, she's just better to be, she's more fun to be around now. Before, with 2 other young kids, we used to focus a lot of our energy on her. Just trying to calm down, don't break this, don't touch that, what are you doing? Don't jump off that. But now she's like the leader of the pack. She looks after the 2 younger kids now. Before, I could not have said that of her. And now she's like the little leader. Even with her class, she helps the teacher, stays on task, gets ahead of task. Yeah, different child. So I cheated. I came with a pediatrician this time. I insisted that someone else in the medical faculty come with me because I see so much of this and Bermuda needs more education. So if anything, that's what I want to do. I really want to educate the population more because a lot of these sleep disorder issues, we see them every day. And I almost feel like I'm the only one who's seeing them. So the beauty of bringing a pediatrician with me is she sees the same kids, but now she knows how to see the sleep disorders. So that's really my goal, is to take the information back, educate people, educate parents that they do have options, that they do not have to wait for their child to grow out of bedwetting or grinding their teeth or having grade 3 and 4 tonsils. They're told to wait. They don't have to anymore. There are options, and there are options that work. 3. And like I said, I have 3 kids. I did start my youngest on 1, yeah. And she had an open bite, so I had to. Yeah. All my kids have had different malocclusions. My son had an underbite, and as you saw in the pictures, we've sorted that out. Yeah. And I was told to wait for him too, and I didn't wait. I think parents have to be the advocates for their own children. And I get that. They trust the healthcare providers and they'll take their word as bond, but doctors are not God, first and foremost. We still have a lot of gaps in our training. A lot of our decisions are based on where we were trained, who our mentors are, what articles we subscribe to. So just know that our knowledge is limited and you should ask questions. And if you don't feel comfortable, if your gut, if your instinct is telling you the solutions they're offering me aren't enough, push back and ask more questions. Be the advocate for your family because there's a lot of information out there and you want to know what that information is. And if it's going to benefit your child, get that information. It's a growing child, you can make a difference whilst they're growing. It's harder when they're older.